Good evening and welcome to our educational webinar on Lapiplasty 3D bunion correction. We appreciate you joining us. I'm Kendall Rock, social media specialist at Treece Medical Concepts. Treece Medical is the company who patented the Lapiplasty procedure and manufactures its instrumentation and implants. Our goal here tonight is to provide you with quality information because we know that making a surgical decision is a decision that isn't taken lightly. We applaud you for empowering yourselves with information to make the best informed treatment decision you can. I will quickly get a couple of housekeeping items out of the way so we can get right into the presentation by our surgeon speaker, Dr. Jason Glover of Rutherfordton, North Carolina. First of all, you are listening to the webinar on mute, but you can ask questions throughout by clicking the questions tab in your control bar and typing them in. We'll be answering questions sprinkled throughout the presentation and at its end. We'll also be emailing you an archived link of this presentation to refer back to within just a few days. Lastly, I know that you will enjoy our speaker, Dr. Glover, but if you are attending outside of North Carolina, you can find locally trained Lapiplasty doctors in your own area to consult with by visiting our patient website, lapiplasty.com. There's a prominent Find a Doctor button at the top of the homepage, searchable by zip code. With all that out of the way, I'd like to introduce you to tonight's speaker, Dr. Glover. Dr. Jason Glover is a board-certified, fellowship-trained foot and ankle surgeon that practices in Rutherfordton, North Carolina. Dr. Glover graduated from the Ohio College of Podiatric Medicine, completed a surgical residency at the Ohio State University, and completed a fellowship at the Wheel, Foot, and Ankle Center. Additionally, he has authored several studies on bunion surgery and a chapter in a textbook. In his spare time, Dr. Glover enjoys watching his kids play field hockey, football, and soccer. We appreciate Dr. Glover volunteering his time tonight. I will return to moderate a question and answer segment at the end. And now for Dr. Glover.
Good evening, everybody. Thank you for joining me to talk about the Lapiplasty. I'm in Rutherfordton, as Kendall said. It's in actually western North Carolina, the western part of the state. We're just right at the base of the Blue Ridge Mountains. It's a perfect, beautiful country on this side of the state. If you're listening, you may have a bunion, or you might know someone who has a bunion, or maybe you're not sure if you have a bunion. Hopefully this presentation will guide you in the right direction. Just some background information on the procedure before we start. The Lapiplasty is a patented procedure that was FDA cleared in 2015. It's manufactured by the company Treece, and over 100,000 patients have been treated. The Lapiplasty definitely requires advanced training as well as a good grip on bunion surgery and knowledge. The surgery is covered by most insurances and not considered cosmetic surgery. What is nice about the company, there's a physician locator to find a trained surgeon in your area. And you can go to lapiplasty.com, type in your information, your zip code and your city. There'll be a bunch of people that pop up that have been trained. You can see how many they have done and where, if they've had advanced training with the Lapiplasty, then you can pick and choose who you want to see. We can go on the next slide. Any surgical procedure, unfortunately, can have adverse events. Adverse events such as infection, which can be controlled by antibiotics, prolonged pain, numbness, whether it's numbness around the incision, loosening of the hardware such as the plates and screws that we use, the possibility of loss of correction, or prolonged bone healing, or possibly bone that does not heal at all. All right, we can go to the next one. So what is a bunion? A bunion is more than just a bump. When I see a patient in the office, they usually describe a bunion as a painful bump on the side of the big toe joint. It can be difficult to wear a shoe due to the width of the foot, and this can cause numbness in the big toe. The joint can become swollen due to inflammation. Pain, swelling, and numbness can get worse as the deformity progresses and gets bigger. If you see at the picture on the right, you see the big toe joint and the bone behind the toe. I like to refer to a bunion as a change in position of a couple of bones in the foot. This first long bone or metatarsal angulates towards the inside of the foot due to an unstable joint, and this pushes the big toe towards the little toes. This creates a bump on the side of the big toe joint. Next slide, please. So a bunion is a complex deformity, as you can see. It's more than just a bump. It's an angular deformity that cannot be treated by just shaving the bone down and making it smooth. The angular deformity is caused by a tilted or unstable joint. Again, on the picture on the right, you can see you have the big toe joint, you have the big toe joint, then the long bone behind it. If you follow the long bone down, there's a joint that's tilted, and that bone goes in that direction. If you jump over to the second toe and follow it straight down, you'll come to a joint that is straight. So everything below that joint is straight. The foundation is straight on the second, so the bone is straight. The joint is tilted at the first, so the base is tilted or angulated. Next slide, please. There are surgical and non-surgical treatments available for bunions. Non-surgical treatments include a wider shoe, maybe a shoe with a soft cloth toe box instead of hard leather. Padding and toe spacers can be used to help alleviate the pressure. Some will use an insert to help alleviate the pressure across the ball of the foot if the ball of the foot is painful. In my opinion, bunion splints or bunion correctors do not work. It'll keep the toe straight as you're wearing it, but as soon as you take it off, the big toe returns as a bunion. A bunion is a bone deformity. It comes back when you take the splint off. The only thing that corrects bunions is surgery. There are over 120 different procedures described to fix a bunion. I think if there are that many procedures to fix a bunion, then there must have been a lot of dissatisfied patients and bad results. Most of the old or traditional procedures are two-dimension. What does two-dimension mean? It means that you cut the bone and you shift it over, but you might be able to move that bone up and down. I think of it as a leaning building or a leaning tower. And again, to the right, there's a leaning tower. If you cut the building through the middle to straighten it, it does not solve anything. To fix the root cause of the leaning building, it has to be fixed at the foundation. A lot of us have heard someone's horror story of getting their bunion fixed, whether it's a lot of pain afterwards, prolonged pain months after the surgery, or even recurrence or return of the bunion. The horror stories, in my opinion, are associated with these older procedures. Next slide, please. The most popular, patented, FDA-cleared procedure that has treated more than 100,000 patients is the Lapiplasty. It's a hot topic now because it's the only procedure that has three-dimension or 3D correction. It's the only procedure that puts the first long bone or metatarsal in a more normal anatomic position. Three-dimension means I can move the bone side to side, up and down, and I can rotate the long bone. Correcting the bunion in all three of these planes leads to a normal position. This is a well thought out, stepwise approach to get the bone and toe straight. Again, if you look at the diagram on the right hand side, instead of cutting the bone through the middle, it is corrected at the foundation where it's tilted. Now that the foundation is secure, the likelihood of the bone angulating again or the bunion coming back is less than 5%. Next slide, please. So how do you know if you are a good candidate for the Lapiplasty? If you feel like you have a bunion, then find someone who offers the Lapiplasty. Look at lapiplasty.com and look for the physician locator and put your information in. Most of the time, x-rays will be taken to determine the severity of the deformity and any other areas of concern, such as arthritis. Another question is my bunion big enough to fix, or is it too big? The Lapiplasty fixes all sizes of bunions, from mild, moderate, to severe. There isn't a bunion that's too severe. This is not true for older, two-dimension procedures. A lot of these procedures cannot fix a severe bunion. If an old procedure is used to fix a severe bunion, then it can be undercorrected and the bunion comes back. If the older procedure is designed to fix a severe bunion, then it's usually unstable and requires long-term cast immobilization and crutches. Next slide, please. So what if I had surgery before and now the bunion is back? Am I still a candidate for Lapiplasty? The short answer is yes. Although this is an unfortunate and unique situation, it is possible for the Lapiplasty to be utilized to correct a failed surgery. A lot of other things need to be considered after a failed surgery, things such as position of the toe, arthritis in other joints, and bone quality, things that are evaluated at the visit. I think one of the more important questions is, how is the Lapiplasty different? Lapiplasty corrects the bunion in all three planes or all three dimensions like we talked about. And when I gauge a surgical procedure, I base it on three important criteria. Is the procedure reproducible? Is it predictable? And does it have good long-term results? So is it reproducible? Can I fix any size of bunion deformity in any patient? Yes, Lapiplasty does. Is it predictable? Will the result be a straight toe? Yes, because it addresses the root cause or the unstable joint. And does this procedure have good long-term results? Recurrence rate is less than 5%. This procedure does stand the test of time. Although it was cleared in 2015, there are long-term studies, but no studies that are 25, 30 years old. In my opinion, the Lapiplasty meets all three of these criteria. It is reproducible, it is predictable, and it does provide good long-term results. Next slide, please. I think another important question is that I hear a lot is, what if I choose not to fix my bunion? What if I just wait and let it get worse? Bunions will. They generally get worse over time. As they get bigger, the big toe puts more pressure on the lesser toes. You can see various stages of these bunions in the pictures. As the deformity progresses, as it gets worse, this can lead to other toe deformities, hammer toes, dislocated toes, spurring, arthritis in other joints, and pain across the ball of the foot, all of which results in more surgery on the foot if you wait. Now, to fix the Lapiplasty, it's predictable. We can get that toe straight. But when you're fixing a dislocated toe, sometimes it's not as predictable. So it's always best to fix it before it causes other problems with other toes. I'm saying if the bunion hurts, then fix it. It doesn't have to be, you don't have to rush to get it fixed, but just put it on your radar to prevent other problems that may be harder to fix. If someone waits, then more work and more surgery may be needed on the foot if the big toe is deforming other toes. Next slide, please. These are before and after results. 3 different sets of feet at different levels of the post-operative phase. Some at 7 weeks, 12 weeks, and 6 months. Since I have started doing the Lapiplasty, in my office, there seems to be less swelling with this procedure. In the picture on the far left, the 7-week mark, if you look at it, 7 weeks is pretty fresh out of surgery, but this foot doesn't look terribly swollen. I believe this is by putting the metatarsal or the long bone in a more normal anatomic alignment. With the older procedures, if you cut the bone in the middle, this causes more inflammation, which causes more swelling. Like I said, just in my experience, the feet don't seem to be as swollen after the Lapiplasty, although results can vary and people are different. But normally it takes, I always tell people, it takes 6 months upwards to a year for all the swelling to go away. Next slide, please. The typical recovery timeline does vary from surgeon to surgeon. When I first started, I was more cautious. I kept people on crutches longer. As I've seen it play out for myself, the procedure is very stable. Now I allow people to walk almost right away. The patented fixation method and hardware creates a stable enough construct to allow early weight bearing. Many older procedures require calf mobilization and crutches for upwards to 6 to 7 weeks. This can cause a lot of muscle atrophy, time out of work, and stiffness. In my practice, patients are walking on their heel for the first 2 weeks after surgery, then they're placed in a weight-bearing boot for 3 to 4 weeks after. Then they transition into a shoe and start formal physical therapy. Time out of work, off your foot, and no exercise is dependent on the doctor you see. As far as exercises, low impact exercise such as elliptical, swimming, and walking can occur around the 3-month mark or sooner. Upper body exercise is always okay. High impact exercise such as CrossFit, running, maybe training for a race is 6 months or maybe longer. As far as return to work, it depends on what kind of job you do have. If it's a desk job or a job that doesn't require full time on your feet, you return to work within 2 weeks. Versus someone who wears steel-toed shoes, walks on hard concrete surfaces for 12 hours. In my practice, they typically stay out longer, 8 to 10 weeks. Next slide, please. The Lapiplasty is usually covered by insurance. I have not had any denials. The foot has to hurt. It's difficult to wear shoes, and it impedes activity. The procedure is always pre-authorized by the doctor you visit. I always say bunion surgery is not cosmetic, but it should have a cosmetic result or outcome. Next slide, please. I think the take-home points of this webinar is the Lapiplasty provides the best correction because it's a 3-dimension correction that targets the unstable joint where the bunion comes from. The Lapiplasty fulfills all three criteria. It's reproducible, predictable, and has great long-term results. The procedure is inherently stable enough to allow early weight bearing, so the economic burden of missing work is low. Most importantly, the Lapiplasty puts all the horror stories to rest. Thank you.
Thank you very much, Dr. Glover. We've had several questions come in this evening. Thank you for the great audience participation. We'll do our best to answer most, if not all, the submitted questions now. So one of the questions that we've had come in during this webinar is, can I have both my feet corrected on the same day at the same time? What are your thoughts on that?
My answer is always no, because you always need one good foot to quote unquote stand on. I think the recovery is a lot better. I actually want people to walk on their foot protected, because that does stimulate bone healing that I want. So I would advise, we want to get things done over with as soon as possible, but I only correct one foot at a time, just so it's easier to get around. It's hard to walk in two boots or two surgical shoes at the same time.
Great, thank you. Another question that has come through is, how long do you have to stay off your feet post-operation? So tell us, in your experience, what do you tell your patients regarding how long they should be staying off their feet?
So my operating day is on a Thursday. I tell them give it to Sunday. I want full-time elevation, icing for the first 3 or 4 days. As it gets plus we do a nerve block at our hospital where the foot can stay numb for a day or two. So I really don't want weight bearing on the foot until the numbness or that nerve block goes away. So after usually the 3rd or 4th day, they can get around the house by placing weight on their heel. I don't allow flat weight on the foot until 2 weeks after. That way, this gives the incision enough time to heal, and I'm able to take the stitches out in 2 weeks.
Thank you. So, in your opinion, how long would a patient have to take off work?
Again, it's variable. If it's a desk job or if the position can be created to where a person is not walking around, they can get back to, or of course, if they work at home, they can go back right away. But a more sedentary job, it's within 2 weeks. I always recommend to my patients at least take 2 weeks. Take the 2 weeks to kind of baby the foot so you can stay off of it. That way it's easier to start walking in a boot. And then once they're in a boot, it's safer, the foot's more protected, the stitches are out. So I always say at least 2, but some people return back to work that first week. Again, if you have a intense job where you're wearing steel-toed shoes and you can't get out of those, it takes a little bit of time to work yourself back into that. And usually around 8 weeks is the mark for that.
Great, thank you. So in your experience, would you recommend physical therapy to your patients after the procedure?
Yes, I always recommend physical therapy. I wouldn't say on day 1, but within that first week, I always go over range of motion exercises. I like to have them do gripping exercises, and it's just, moving the toe, getting the toe moving. Because the toe is in a different, of course, it's in a different position. It's in a normal position, so it takes time for that tendon to kind of be retrained and to get strength back in that tendon. So range of motion exercises are started within the first week, and then more formal physical therapy, I usually start that whenever they're transitioned into a shoe around the 6 or 7 week mark.
Great. So how soon will a patient be able to return to physical activities, including the gym or outdoor recreational sporting events?
Lower impact activities, walking, walking for exercise. If it's a flat surface, that generally within 3 months. Volleyball, probably 3 months, backyard games like that. Of course, any upper body exercises, weightlifting can be started at any point during the healing cycle. Higher impact activities, I scale people back until about the 5 or 6 month mark. Lower impact ellipticals, swimming, that can be started 3 months or earlier. Kind of just gauge it on how the patients are doing when they're walking. If they're walking relatively straight without limping, I tend to accelerate the weight bearing aspects and the exercising. But I would say around the six months is a good mark for pretty intense exercise.
Thank you. So how soon would you say a person can shower or go swimming after getting the Lapiplasty procedure done?
So they make these pretty slick cast covers. You put that on, it comes up above the knee and it cinches off. You can wear that in the shower. It keeps the foot totally dry. You can do that day 2. The bandages, in my practice, they stay on for 2 weeks. They're not changed. At the 2-week visit, the stitches come out. After that, the foot can get wet in a shower. As far as, submerged in standing water, such as a hot tub, a pool, I don't like that until 4 weeks after surgery. There's a lot of prolonged, submerging in water. It can get the skin too moist and macerate the incisions.
Got it. So another question that has come through is, I live in a 2-story house. How should I plan to get upstairs? Can I walk up the stairs, or should I plan to stay on the first floor for some time?
I would stay on the first floor for the first 3 or 4 days. If you were my patient, you would receive a nerve block, and that nerve block would last, like I said before, a day or 2. And I really don't want people hopping on their heel when they can't feel it, because other injuries can happen. So I'd stay on the first level for the first 3 or 4 days. When you're comfortable, you can take 1 step at a time and pivot on your heel up and down. Or I've also had people ride up and down the steps on their butt, and that's probably a safer way to do it. I wouldn't venture up and down the steps on crutches, but 1 step at a time, pivoting on the heel is fine.
So if a patient were to live alone, do you recommend they have someone come stay with them post-surgery for a few days, or what is your typical recommendation?
If you can, I would have someone stay at least a week, at least plan on a week. The important times are the first 3. Well, the important time is the first full week, but typically the first 3 days is when you should have pretty much laying in the bed, going to the couch, or sitting outside. Have someone to help you get food, run to the kitchen for you, get water. So at least 3 or 4 days, have someone stay with you, but preferably a week.
Thank you. Another question that has come through is, how long until I can drive after undergoing the Lapiplasty procedure?
Left foot, you can drive anytime as long as you don't have a clutch. If you have a clutch, or if it's your right foot, my instruction is 6 weeks of no driving. The first 2 weeks you're walking on your heel only, shouldn't be driving. After that, you're in a boot for 3 or 4 weeks. Here, it's illegal to drive with a boot on. there isn't, because you can't bend your ankle and it's hard to feel the brake and the gas. You can wear a surgical shoe, which is more of just a flat shoe. You're able to bend your ankle. I've had people drive in that at the 4 or 5 week mark. Then they get out, put the boot on. The boot is more protective. If you can switch around like that, you can drive earlier, but typically to drive comfortably with the right foot or to clutch with the left foot, it's at the 6 week mark where you can keep your foot on the brake at a stoplight or slam the brake for an emergency situation. So it's around 6 weeks.
Thank you. I know we talked about this a little bit earlier, but what makes a patient an ideal candidate for the Lapiplasty procedure?
Yeah, so an ideal candidate, I've operated from 17 years old up to 79 years old. Older in age, we have to look at health and activity, certain medications. The ideal patient is a non-smoker, active person. In my opinion, age doesn't really matter. It's just how active you are.
So if a patient is to smoke, will that prohibit them from being a candidate for this procedure?
It's not a contraindication. I operate on smokers. I'm careful on how I handle the skin and the tissues. Sometimes I'll incorporate some bone graft in the fusion area that can accelerate bone healing. Because with smoking, studies have found that it does inhibit bone healing, and if this bone doesn't heal, then it goes on to what's called a non-union or no bone healing, and then it has to be revised, or the bunion comes back if the bone doesn't heal. So, if I see a smoker, I don't tell them no. I just, coach them into maybe stopping at some point prior to surgery and during the first 6 weeks. If I can get them to stop forever, that's perfect. But nobody's perfect. And but I'll incorporate some good bone healing things during surgery to get that bone to heal.
Got it. So similar to a patient being a smoker, what about if a patient is currently taking one of the newer weight loss drugs? Do they need to stop taking this drug to have the procedure done, or can they still take it and undergo the Lapiplasty procedure?
I've had no problems with stopping the medication. The only time I stop one of them, it's Ozempic, and that's for anesthesia purposes. But as far as stopping weight loss medicines during the procedure, I do not stop them.
When you say anesthesia, what type of anesthesia is used for this particular procedure?
At our hospital, we utilize general anesthesia. That's the most relaxed state a person can be in during surgery, because I don't want, because in some types of anesthesia, you can still move your toes, while you're sleeping. But with general anesthesia, you're totally relaxed. I have full control of the foot without any muscle or tendon trying to, prohibit the correction I'm trying to get. And with the general, they will do a peripheral nerve block, it's called, where they use an ultrasound machine to localize the nerve and to put this local anesthetic around the nerve. This keeps your foot numb for a day or two. So this gets people over the most painful part, or the most painful days, which is the first 1 or 2 days, and then it sort of decreases. And then with the oral pain medication, it really does keep people comfortable.
Regarding pain, what do you prescribe to your patients to take post-operation to combat those days that you were saying are painful or they're feeling a bit swollen?
Right. So elevating and icing are the two most important things, for the first couple weeks after surgery. Icing on top of the foot, putting ice behind the knee really helps with the pain level afterwards. I do write for oxycodone or Percocet, and that really does take a lot of the pain away. I will incorporate it with limited ibuprofen if they can take that. I will prescribe an anti-nausea medicine to help with side effects from anesthesia or even the pain pills, and this will sort of knock people out as well and help with the pain.
Thank you. Another question that has come in quite often this evening is, can a diabetic have this procedure done?
Yes, and again, diabetes is it's a tough disease, and I think more research needs to be done to find a cure for diabetes, but that's a side note. I'm careful to, evaluate the blood flow to the foot. That's number one. And number two is, what's their, is their blood sugars or glucose monitored, and, is it relatively controlled, as well as their A1C. So those are the questions I will ask. If the sugar is 200 or above, we'll have to work on that before surgery. But if the sugar is controlled, then the outcome's a lot better. The bone heals better. I will incorporate, again, as with the smokers, I will incorporate things in surgery to help promote bone healing. I will add bone graft to the fusion site to give that area more bone cells to form bone.
Thank you. Another question that's come through is, if a patient has arthritis, can they still have the Lapiplasty procedure done?
The answer is yes. It depends where the arthritis is. If the arthritis is where the surgery is going to be, then that arthritis is eliminated. Arthritis could be in the big toe joint, and if the arthritis is in that joint, then the bunion has to be corrected by other means. It's still the idea of the Lapiplasty. It's still with the same company, but we can't fix a bunion if there is a lot of arthritis in the big toe joint. Sometimes an additional fusion or an additional procedure needs to be done. That's where a consult with your doctor and getting x-rays will kind of guide the surgeon into what direction.
In your experience, how long does the Lapiplasty procedure typically take?
So I've done probably close to 300, and it takes me 1 hour. I've tried to cut down that time, but I'm, maybe sometimes it's 40 minutes, sometimes could be an hour and 10 minutes. If it's just a straight bunion, no other procedures, it takes me around an hour. I don't rush it. When I was doing older traditional procedures, a traditional procedure might take me 10, 15 minutes. And I think this is why some people do the Lapiplasty and some people don't. Some surgeons want to be done and out of the OR in 15 minutes. But I wasn't happy with those results. That's why I looked into Lapiplasty, and I will accept a 1 hour procedure, or I'll accept an hour and 20-minute procedure for the results I get.
So another question that has come through is, if I had a bunionectomy in the past, am I still eligible candidate for this Lapiplasty procedure?
Yes, you're a candidate. There's other things we have to look at to make sure, is there other hardware? Is there other hardware in the way? If so, that can be removed. But it all depends on what type of other bunionectomy procedure you had. But yes, the Lapiplasty, for the most part, can correct a failed bunion surgery.
Great, thank you. Would you say there's any way to correct a bunion without undergoing surgery?
What was that question again? I'm sorry.
Is there any way to correct a bunion without undergoing surgery?
In my opinion, there is no other way to correct a bunion besides surgery. Like I said, you can purchase a bunion splint or a bunion corrector. It'll hold the toe straight. You can't wear those with a shoe because they're too bulky. But as soon as you take them off, that big toe will drift back and the bunion returns. Only way to fix a bunion is with surgery.
Great, thank you, Dr. Glover. Another question is, I have a pretty significant bunion, but I am not in pain. Do you recommend I hold off on getting the procedure done?
If it's a severe bunion, that means there's a possibility of other toe involvement. In my practice, in my opinion, I would, instruct that person to have it fixed sooner than later. I wouldn't, if it's not painful, I would be worried about other deformities that come up. And if it's severe, there almost has to be other toe deformities. And if you let it go too far, then arthritis can set up in that big toe joint as well. And so you may need, besides the Lapiplasty, you may need another fusion on top of that. So if it's a severe bunion, I always instruct to get that bunion fixed.
Got it. So we talked about this a little bit earlier, where if an individual has bunions on both their feet, to wait a little bit in between. In your experience, how long do you advise in between surgeries for an individual who may have bunions on both their left and right foot?
Sure. I don't have, a length of time that's set in stone. I closely evaluate the patient. I see how they're doing, if they're walking okay, if they're in the shoe comfortably. If that freshly operated foot can accept a lot of the weight when the other foot is done, if they're comfortable with that, then we can proceed with the second surgery. I think the fastest turnaround time I've had is probably 9 weeks, 10 weeks, around that area. And that's probably a good answer to the question. I think within the 3-month mark is a good timeline.
Got it. Another question we've gotten is, I have a hammer toe as well. Can I have that corrected at the same time as the Lapiplasty procedure?
Yes, I would personally correct that at the same time. I would not do the Lapiplasty and then bring the patient back for a second procedure. Whatever, if there's a bunion and some hammer toes, they would be corrected at the same time.
Additionally, another question came in that asked, can you perform a Lapiplasty procedure to correct a Taylor's bunion?
Taylor's bunion is a different type of bunion. In my experience, those bunions never progress. Well, I shouldn't say never, but they normally don't progress like a bunion at the big toe. They tend to get bigger, then they may stop and stay in that position. I actually published a research study on Taylor's bunion and a specific procedure that we did at the Weil Foot and Ankle Center. And it's a Z type cut in that bone, and it's pretty stable. These Taylor's bunions or bunionettes, they are amendable to other procedures, whether they're older procedures. And it does not require something like the Lapiplasty. Lapiplasty is only unique to the big toe.
Thank you. So we're talking a lot about the Lapiplasty procedure. We're talking about hammer toe. We're talking about Taylor's bunion. Are there any other restrictions that you can elaborate on that we should know about a patient will more than likely experience during their recovery phase?
What was that, Kendall, again? I only got part of that question.
Yeah, so just talking about the Lapiplasty procedure and hammer toe and Taylor's bunion, with all these things being done, can you elaborate more on what are potential restrictions that our patients will be facing during their recovery phase?
The biggest restrictions are, weight bearing, and that's protective weight bearing. That's not, going to the store or shopping for an extended period of time. Driving is the other, depending on the foot. And I think that's one restriction. I think those are the biggest restrictions. Bathing and getting the foot wet. That's another restriction I don't allow my patients to do, and not unless it's protected with a cast cover. As well as, walking unprotected, that's a big no. So those are, I don't know if that was kind of your question.
Yep, that was perfect.
Yeah.
We have time for a couple more questions. So another question that has come through is, will I have a scar? And if so, how big is that scar going to be?
So scarring, I couldn't tell you how, big my incision is. I try and keep it as minimally as possible. And I try and, with meticulous dissection, not handling the skin roughly. I also use I call it a non-reactive suture. I don't keep my stitches in for a long time. If you form keloids, if you're bad with that, that's a different issue.
Thank you, Dr. Glover. We talked about this a little bit in the beginning of our presentation, but can a bunion be too severe for the Lapiplasty procedure to correct?
No, the Lapiplasty can correct a very severe or a mild bunion. There's no bunion that's too big for the Lapiplasty. The thing with the Lapiplasty, fixing the bunion at the root cause or where the bunion originates from, that allows for greater correction. So I always say the bigger the bunion, the better.
All right. Can you comment on a patient who has osteoarthritis? Can this person still undergo the Lapiplasty procedure?
Yes. Is it osteoarthritis? Yes. Osteoarthritis, that's arthritis. So yes, the Lapiplasty can be performed, again, depending on where the arthritis is. If it's in the big toe joint, an additional procedure may need to be performed to fix that. I don't know if the question they meant osteoporosis. Yes, that's something, I'll just take it to that level. Osteoporosis, it's possible. We have to be very careful. So with osteoporosis, the bone can be soft, and we have to be careful with the dissection and how we prepare that bone. But even with osteoporosis, the bunion can be fixed with the Lapiplasty.
Got it. So during the presentation, a lot of people have expressed interest in the Lapiplasty procedure. How does an individual go about finding out more information or scheduling a consultation with their doctor?
Yeah, the easiest is to go to lapiplasty.com. I'm not sure where the link is. There's a physician locator link. You just type in your city or your zip code and the list will propagate. And if you want to check each individual person out, you can expand the search area out 50 miles, 100 miles, and a list of surgeons will come up. And then the office info should be located there, or there's help on that locator, and you'll be directed in the right direction.
Great. Thank you, Dr. Glover. So as we begin to wrap up now, if your question did not get answered or you think of something later that you wish you'd ask, feel free to reach out to us. Our email address is patientinfo@treece.net. You can also learn more or find a local doctor by visiting our patient website, www.lapiplasty.com. Don't forget that as a follow-up, we will email all registrants an archived webinar link for reference. We hope you found the information presented tonight helpful. Dr. Glover and I appreciate you joining us. Have a nice evening, everyone.